Research from satellite images shows that COVID-19 has attacked China since last fall. A study by Dr. Brownn Brownstein, Harvard medical professor, and his colleagues uncovered unexpected facts regarding the identification of an official pathogen, called SARS-CoV-2. Using techniques similar to those used by intelligence agencies, Brownn Brownstein's team analyzed images obtained from commercial satellites, and they observed the significant increase in car traffic outside the 5 major hospitals of Wuhan, starting in late summer and early fall 2019. By identifying the signs when the population of Hubei Province in China begins to be affected, they try to do is to look at activities, see how busy a hospital is. And the way we do it is to count the cars in that hospital. Parking will be full when the hospital is busy. Therefore, more cars in hospitals, and hospitals are busier, possibly due to something happening in the community. Infections are on the rise and people have to see a doctor. So you see the increase in hospital business through cars. Starting with nearly 350 images taken by private satellites around the globe, the Brownstein team first examined traffic and parking outside major hospitals in Wuhan in the past 2 years. Among them are photos taken from space every week or every 2 weeks in the autumn of 2019. From about 350 frames, researchers have found 108 images that can be used, showing the unobstructed location from smog, tall buildings, clouds, or other features can complicate analysis satellites. The findings were interesting when the team noted that on October 10, 2018, there were 171 cars in the parking lot of Wuhan Kcvc Hospital, one of the largest hospitals in the city. A year later, satellites recorded 285 cars, an increase of 67%. Other hospitals showed a 90% increase when comparing traffic between autumn 2018 and 2019, according to the study. At Wuhan Tongji Medical University, an increase in car traffic was found to have occurred in mid-September 2019. According to Brownstein, respiratory diseases lead to very specific types of behavior in the communities where they spread. So photos showing those types of behaviors can help explain what is happening, even if those who were sick didn't realize the bigger issue at the time. The research team found that the increase in vehicle traffic outside Wuhan's big hospitals also matched the rising query with a Chinese internet search for certain symptoms that were later identified as closely related to the new strain of coronavirus. All forming a picture that one can imagine is that in the fall of last year in Wuhan, the increase in car traffic going to and from hospitals in Wuhan increased sharply. At the same time, the Chinese internet at this time also increases the search traffic for information on a certain type of symptoms that was later identified to be closely related to the new strain of coronavirus. These issues suggest that the very possibility of respiratory diseases itself has led to very specific types of behavior in the communities where they spread. Wuhan was then faced with a serious epidemic that drove people to hospitals, and people frantically went to the internet to learn about respiratory illnesses. According to Tom Diamond, president of RS Metrics, which is part of a team with Brownstein's research team, the Wuhan region was clearly experiencing a widespread health problem in the months before the Chinese government made it public that an infectious disease is sweeping through the densely populated city. The announcement came on New Year's Eve when the Wuhan City Health Committee in China reported a group of cases of pneumonia in the city. Satellite imagery showing the change in life patterns in Wuhan is also a major factor in early classified U.S. intelligence reports. Former Homeland Security Chief John Cohen, who oversaw IBM intelligence operations during the Obama administration, said the new study showed that COVID-19, which killed more than 110,000 Americans, is likely to be taken. Coming to the U.S. from Wuhan has long been discovered. Through this study, it created an important new data point related to the riddle of the origin of COVID-19. And it is no wonder why Chinese officials did not officially notify the World Health Organization, WHO, until December 31st about a new respiratory pathogen that was swept through Wuhan, the state. U.S. newspapers reported the issue as early as late November and notified the Pentagon, according to 4 sources revealed. From the study, we hope one day the truth about the origin of COVID-19 will be exposed to the light of justice.